Good afternoon, my name is Lissette and my topic is ventricular hypertrophy. The definition is that it's the thickening of the ventricular walls in the heart. Although left ventricular hypertrophy is more common, enlargement can also occur in the right ventricle or both ventricles.
Talk about ventricular hypertrophy, and that simply means that there's an increase in the muscle mass, and it usually means an increase of the muscle mass resulting in a muscle that's less effective in terms of maintaining cardiac.
The application in medicine, we have the left ventricular hypertrophy, that is enlargement of the muscle tissue that makes up the wall of your heart's main pumping chamber.
Ventricular hypertrophy, or LVH, is a very common abnormality. Because of its clinical importance, attempts have been made to develop reliable ECG criteria.
Because we have the high blood pressure that requires the left ventricle to work harder. As the workload increases, the walls of the chamber grow thicker, lose elasticity, and eventually may fail to pump with as much force as that of a healthy heart.
Increase in left ventricular weight. It shows up as high voltage on the ECG with this T-segment changes.
Although this isn't very sensitive, the ECG changes are found only about 1/3 of the time.
In the right ventricular hypertrophy, we have the blood travel through the right ventricle to the lungs via the pulmonary arteries. If conditions occur which decrease pulmonary circulation, meaning blood doesn't flow well from the heart to the lungs, extra stress can be placed on the right ventricle. This can lead to right ventricle hypertrophy.
Below or right ventricular hypertrophy is the boot-shaped heart on X-ray.
The causes from this we have the pulmonary hypertension, tetralogy of Fallot, pulmonary valve stenosis, pulmonic regurgitation, ventricular septal defect, high altitude, cardiac fibrosis, chronic obstructive pulmonary disease, and athletic heart syndrome.
Results in low oxygenation of blood due to the mixing of oxygenated and deoxygenated blood in the left ventricle via the VSD and preferential flow of the mixed blood from both ventricles through the aorta because of the obstruction to flow through the pulmonary valve.
The advantage we have that ventricular hypertrophy may be first noticed on an electrocardiogram. If your doctor sees evidence of LVH on your ECG, you will have an echocardiogram to determine if you have the condition.
Does the ECG satisfy some of your criteria? Well, before applying any voltage criteria, you first make sure the ECG machine is correctly calibrated.
And this advantage we have that there are complications like feeling short of breath, chest pain, feeling dizzy or fainting, a rapid heartbeat, or a pounding or fluttering sensation in your chest.
This is known as a right-to-left shunt. The primary symptom is low blood oxygen saturation with or without cyanosis from birth or developing in the first year of life.